Good evening, everyone. What I thought I'll do today is talk less about mHealth and eHealth. I think there is some discussion has happened. Pankaj is also here. He will, I'm sure, talk about eHealth more. I will try to concentrate more on the implementation and adoption challenges. That, and then definitely talk a little bit about our technology partners and roadmaps. Definition of eHealth, this is the way as IBM we look at, this is the global definitions. We are working with the same slide globally in all countries. And this is something what I found in common. Most of the time, whenever I present in India or we present in multiple countries, we need to change the slide depending on the context. But here I found a commonality. E-health is a subject where I personally found that it is working in the similar pace in all the countries. Some country may have catched up earlier, but not having e-health in our country is blessing in disguise. We will definitely catch up better than other countries. And I'm very confident the way we have done in our mobile technology, we definitely see people using mobile, and the adoption of mobile is much more in our country compared to a lot of other countries, even compared to the developed countries. I'm sure e-health is also going to play the similar role over here. Objective of e-health in our case, as we see, is build a collaborative platform, and that's very important, sir. As you rightly pointed out, we do have systems. It's not that we don't have anything. We do have systems, but our primary challenge is the systems are not talking to each other, or even they're talking to each other, they are not talking the same language. So nobody is able to understand what the other guy is telling. So how we can work out a collaborative platform, that's the major challenges that I see. Talking about some of the basic components of eHealth, this is does not limit to entry of medical records into the system. I would like to emphasize on that fact that eHealth encompasses all the aspects of healthcare. It's not merely what we called a EMR or creating a medical record for the patients. What we found out that if we are only working on silos and trying to build a EMR where we will have a single patient's data stored in such way and form that can be accessible in future, that's not going to be the eHealth in true sense. So we need to have a complete system, all of them working together. Be it a clinical information system, a laboratory information systems, or a RIS, PACS, or a pharmacy system. Or we're talking about if a doctor is having his own chamber and he is doing some work in his office, that work needs to be correlated with when the patient is admitted in the hospital. It should not happen that whenever a patient is being treated by a doctor independently, and when he goes to the hospital, his records are all lost and is not available to the doctor who is treating him while he is admitted. So we need to have a collaborative environment and having all of them working together. From a government perspective, we definitely look at a disease surveillance systems and also the fraud and abuse management system as an important factor. The other area where I would like to emphasize, and sir, particularly looking at Gujarat, as because you have put up some questions, I'll try to answer a couple of these. The social program management, this becomes a very important topic. It's not only about building some applications. It's also about making sure how the government social programs are reaching out to the end customers, the end users, the actual people of our country for whom we are building these programs. And sometimes we keep hearing that most of the things are lost in transition. So when say something like a program is being built with a good intention, but when you go and check with the actual users, they generally do not get the benefit what actually government is planning to provide them. So the social program platform is going to build that gap in that way, and definitely we need to have a national infrastructure. Only by implementing eHealth in some states and by some progressive hospital group is not going to provide us the eHealth. We all work towards having our own record, the way we are looking at Aadhaar, and I was very impressed looking at the Aadhaar stall and the way the discussions have been progressing. We definitely need to have a health record in the similar way and fashion. Mobile adoptions, Andy has talked a lot about it, so definitely we'll leave that. But as in India, and I have seen these mobile adoptions throughout my life, is definitely is one of the area. And what I found out is using mobile devices for healthcare, is going to happen. We are using it for all other purposes in our life, And I'm sure it's a matter of time when we're going to use mobile health devices for healthcare. And when you look at the various trends, like why people are using mobile today, it's not that I want to make a call to my friend. So it's more towards all the other factors what I use in a mobile. Basic call making functionality of a mobile is given. Nobody's talking about that. And none of the advertisement we see any mobile companies talking about that you can make a call. So they are all talking about the other factors what they provide. And I'm sure in going forward, we'll also see the mobile companies are selling their mobile phone because of they support some health application devices, etc. That's going to come up. A lot of people, as I understand, are working on those. And in India, like a country where we have a challenge of reaching out to the people in the rural areas and even sometime in the urban areas because of the distance, and it's not that hospital is always accessible in the middle of night, how we can use mobile devices to mitigate our healthcare challenges and risks, that's definitely is going to come up. I'll leave this one quickly. Looking at what we are doing in the era of digitizations. Now we have started using digital devices throughout our life. No escape. My father, 70 plus, he sometimes tried to avoid using it, but finally he has adopted to use it. And he is telling that, today I prefer to go to the bank and do a transactions standing in the teller counter, but for him it becomes really difficult because most of the time the teller guy is telling that, uncle, why you are coming to the bank, why don't you go to the ATM and use your ATM card, and you can get the money in the middle of night. So we have no escape, and now he has started depending more on the mobile alert and messages which he is getting from bank when his pension is deposited, and he is very happy about that particular fact. And then use of digital medium in healthcare, we have seen a lot of things are happening. How we can plan to get this done, that's important things. I would like to introduce this concept of a digital hospital over here, where we are talking about that how we can utilize various digital medium, what we are utilizing otherwise in our life. So it's not that talking about getting some new invented mobile or digital technology for use in healthcare. It's all about choosing the devices, what we are using otherwise in our life for running our hospital operations and clinical business. So that's generally we consider as a digital hospital scenario, and we have seen, and there are a couple of case studies where we found out that by uses of digital medium appropriately, hospital could have reduced their waiting time and also could have be more efficient, at least 50% in 2 case studies that we have seen, and I will be very happy to share those time. I have got a slip of 3 minutes, so I can share it now. Looking at digital hospital environment is generally, it's about enabling the smarter processes. So the similar processes, but we are doing it differently so that the outcome of those processes are much higher. So we are enhancing the patient experience. At the day end, whatever we do, if it is not impacting the end users, that the patients, there's no point of doing that. So all our emphasis is towards looking at doing something which will make difference in the end customer, that's the patient's life. And we have seen there is a direct correlation between what a digital environment can do for this. The questions of whether we need mHealth and eHealth, I don't think, this was a question earlier. This is not a question anymore. So we need it. I'm sure if I ask these questions, all of you said yes. But the question today, what we see that how we can have it. I keep meeting, the hospital CEOs and chairmen and hospital IT team members regular basis. Another important part, timeline of the project. It's not like that, it's a 6 months mandate and I have to deliver the project in 3 months. So if a pregnancy has a 9 months time, then it takes 9 months. And any of this premature delivery has its own problem. So there's no point of having a project in less than required time and put it in an ICU. And because that is what we are seeing in most of the hospital information system, so-called implementation project in the country. And as a vendor partner, we are enthusiastic to pick up a project and then unable to deliver. So this is a regular challenge that we are facing. Timeline is very important. We have to get the appropriate time, what it takes. Integration challenges, this is very important, and we have to have a common platform for integration. So we cannot have one system delivering everything. We definitely need to have system best of the breed, all of them are working together. Technology trends, we need to understand that what technology is working today and what is coming up tomorrow. And sometime we have to be also understand what is the technology limitations. I cannot do everything using my iPad. Let's be very clear about it. We will be using iPad for certain functions, but iPad cannot be used for each and everything whatever others devices are doing today. So let's try to find out that what we should use where. And investment. IT requires investment, without which is nothing is going to work. This is not an expenditure. This is an investment. You invest, you will definitely get the return. Adoption issues, we found, is another one. After the implementation, we also found out that there are challenges, and most of the cases what we see, the eHealth and mHealth initiatives are not seeing the light of the end of the day because of the adoption. And the adoption issues, and I put out issues very clearly, not challenges, because I found them as issues, is a change management or management of change. The way I used to work earlier, and most of the cases is happening with a mid-age persons like me, all crossed 40, and then some other things has come in my life, is very difficult. The way I see my son adopts technology is much, much faster. Definitely I am faster than my father in adopting a ATM card, but definitely I am not as fast as my son, the way he picks up newer technology and trend. But the question is, I have to pick it up. And how I can manage the adoption of change. The change management part in this adoption is very important. We have to handle it professionally as a change management. We have to be aware of the fact that we cannot run the same processes what we used to run earlier. The automated processes, if we are talking about, that should not have the 10 steps what we used to do in manual processes. And we have to be open to change the processes when we are doing this implementation. There is no point of telling that, oh, this is my processes, it has got 10 steps, please automate it. It cannot be done. And we have to demonstrate the benefit to the end users. They should be able to see visually objective benefit what they are getting out of it. Only most important point is train, train and train. What we found out at the end of the implementation time, there is no time for the training. We tell the users, you use it and you will learn it. That's the suicidal approach. Let's not do it. If we have to roll out a project after 3 months, let's do the training appropriately and do it. Because most of the cases, the people throughout the eHealth and mHealth initiatives out because of it does not work. It means that they do not know how to make it work. And it's a journey. So we have to have patience. It's not that today I will start and tomorrow it will end. This is like a lifetime journey. We have to keep working towards this mHealth and eHealth initiatives throughout. Stakeholders definitely play a very important role, and we have to have them with us through the program, and also talking about the alignment of people and processes. The last part I would like to talk about is that when we are deciding about technology partners, then we have to find out what works for me. Choice of appropriate technology is very important. It's not that I'll go to a hospital, see what they're doing, and then tomorrow I'll try to adopt the same thing. We have to define this roadmap. Clearly, we have to articulate the roadmap ourselves. Have phases, a project in the phases, and then have the patience of implementing it throughout. I think I've got a 0-minute slip, so I've got no option but to stop here. Thank you very much.